Carnivores, welcome back to the channel. It's me, Bella the Steak and Butter Gal. I hope you all are having a meat-fueled day. In today's video, I'll have the honor to invite on Dr. Leslyn Keith to share her knowledge on lipedema, lymphedema, obesity, and fat disorders. She'll be sharing her knowledge on what lymphedema and lipedema are and telltale signs that you may have it. She'll also be detailing her protocol and best tips on how to resolve it if you do struggle with it. Before I get started, I do want to share that I am inviting Dr. Leslyn Keith to the Steak and Butter Gang community as a guest speaker. All members will be able to submit their questions for Dr. Keith, and she will answer and share her knowledge live in the community. And as always, the playback will be posted for the entire community to enjoy and learn from anytime. In addition to Dr. Leslyn Keith, I will also be inviting on Dr. Anthony Chafee, Dr. Robert Kiltz, Dr. Tony Hampton, and Coach Rebecca Heichman to visit the community and answer everybody's questions. To not miss this fantastic lineup coming up, make sure to join the next challenge at sbgmeetup.com or check out the links down below for clickable links. Now, without further ado, let me invite on Dr. Leslyn Keith.
Hi, thanks for having me here. It's so wonderful to be here with all of you. I'm Leslyn Keith. I have a doctorate in occupational therapy, and I focus on lymphatic disorders. And I've been treating lymphatic disorders like lymphedema and lipedema for about 25 years. And at about 2011, 2012, I discovered ketogenic diets and started experimenting on my patients. I started experimenting using it to help their condition. First, just to try to help with obesity and weight management, but quickly started seeing how, wow, even if you don't have weight to lose or you're trying to manage your weight, it seemed to have an impact on lymphatic disorders. So I'm just so excited about this way of eating and what it can mean for health.
For those who are not familiar with the terms lymphedema and lipedema, what does it mean and how do you detect if you have it?
Excellent questions. I first got exposed to lymphedema when I was doing an internship for occupational therapy, and my mentor supervisor was treating lymphedema, and it just fascinated me what the treatment was and how spectacular it worked for the condition. So lymphedema is a lymphatic disorder where the fluid is not able to get out of a body area because the lymphatic vessels were not perfectly formed from birth, or there was damage to them later in life. And the most common reason that there's damage to the lymphatics is surgery for cancer, and also radiation treatments for cancer treatment. So quite often they're removing lymph nodes. You may have heard, for instance, like for breast cancer treatment, they remove the lymph nodes under your armpit on the side of the breast cancer. And unfortunately, that's the place where the lymphatic fluid from the breast and from the arm all drain. And so you remove some of those nodes and now it doesn't drain as well. And so you start getting this backup of fluid. And so this treatment was developed, back in the 1930s and 40s to manage that swelling that would happen because of, various reasons. Like I said, you can be born with it or you have damage later. And so I first got exposed to that treatment in my internship, and you do a specialized type of massage. You wrap the body area with compression bandages. You do some certain exercises, and there's really meticulous skin care because you're at risk for infection. So you do this overall program, and it just was such a objective black and white difference. Their arm was this big, and now you finish and it's this big and it matches the other side. And I like these black and white things. I tend to be left-brained and I like to see these very objective results. And so I thought, this is the treatment for me. And so I started getting into that and treating that. When I got certified in training on how to treat lymphedema, we also talked about lipedema. And lipedema is, you kind of end up in the same place as lymphedema, but it starts from a different place. And so lipedema starts out more as a fat disorder. We have this excessive fat deposition almost exclusively in women and to their lower body mostly, but it can also occur in the arms. And so it's like this waist to ankles presentation of a very uneven distribution. It's like you have two bodies. It's the upper body seems that much smaller than the lower body. And unless there's also obesity present, they have a very narrow waist. And the problem is this is not just aesthetic. These women have sometimes very, very intense pain in the areas that have the diseased fat. They bruise easily. Their mobility gets reduced, sometimes from just a reduction in muscle mass, but also because of the pain and the large amount of adipose tissue. So they get all these other things that happen because of that. And then the lymphatics fail probably because of this excessive adipose tissue. So now you've got this, all this fat plus the swelling from lymphatics not clearing out. Interestingly, in lymphedema, there's something that happens when we have that fluid collecting in a body area. It causes the proliferation of fat. And so both of these conditions have excessive fat and fluid, but they come at it from a different place.
You mentioned that you've been using the ketogenic diet to help your patients with lymphedema and lipedema. I'd love to know what benefits you've seen with your experience.
Sure. So at first, I was just trying to help my patients who had obesity, and they had weight to lose because there was a prevailing thought in the lymphology community that obesity can cause lymphedema, and there is some evidence for that excessive fat can cause this lymphatic failure. And so I thought, well, we reduce the weight, and then the lymphatics start functioning better, and then the lymphedema improves. And so first I was using it myself, all my friends, a couple of my family members, we started using it, and we felt great and had lots of energy and lost a little bit of weight. And so I started presenting it to my patients, and the ones that were willing to try it, whether they need to lose weight or not, it had a good response. So at this same time, another person was writing a book about nutrition for lymphedema and lipedema. And he showed me the draft copy of it. And it was promoting the typical recommendations of a plant-based diet, low fat, low calorie, and this would help. And I started thinking, I'm not so sure that would help. And I think we need something different than just what we've always done for the last 100 years. And so I decided to get my doctorate so I could run a study to see the impact that a ketogenic diet would have on people who had lymphedema as well as obesity. And the effects were pretty astounding. It was just a little pilot study with 10 patients, 6 of whom decided to adopt the diet and 4 who didn't. And the 4 who didn't, they were my patients, I had treated them before, and they were so apologetic. They said, Leslyn, I think I've ruined your study. I didn't do the diet. I said, no, actually, it shows the difference. I would like for you to be able to adopt it eventually because it's going to help you so much, but it really showed the difference. And so I measured things like pain, ability to perform your activities of daily living. I measured there is this one scale that is the lymphedema life impact scale, the impact that lymphedema has on your life. So I measured that. I measured the size of their limbs. I measured their weight, and I also did body composition. So I think you can probably guess who had the better results in all of those categories. Every single one. The people who used the diet, albeit very small groups, 6 and 4, but the people who used the diet had less pain. Their quality of life was dramatically improved. They had lower weight. Their body composition they had lower percent body fat. So all these things you can guess happened in that group. And overall, if I just average the results of everybody, it had significant results by participating in these lifestyle changes that included a ketogenic diet. But as I said in my paper, when I published the paper of my results, I said those results were driven by how much the people who used the diet improved. So I was pretty excited about that, and then just started really promoting it with all my patients. And I started speaking about it in conferences. So interesting that, when I first started talking about it in 2014, I was the only one in the lymphology field who was talking about it. And they all looked at me like I was crazy. They say, yeah, sure. Eating this way is going to help. Or they would say, oh, it might help with lymphedema and weight, but they're going to die of a heart attack. It's going to be terrible on their cardiovascular system. And so I'm the only one talking about it. Well, unknown to me, a practitioner of an MD in Germany had already been using this way of eating for her patients with lipedema. And lipedema, besides the picture that I just described to you, lipedema was known for the last 80 years, since it was discovered in 1940, that it was unresponsive to diet and exercise. Well, we know that exercise doesn't have a huge impact on weight loss. Well, it's good, but diet especially, they were talking about using a low calorie, low fat, plant-based diet. Well, of course it wasn't responsive to that way of eating. Sometimes obesity is responsive to that, but lipedema, absolutely not. And so this doctor in Germany had been using it. She had, besides her MD, she also had a degree in nutrition. She started using ketogenic nutrition with all of her lipedema patients. The first thing she found was with just a couple of weeks, the pain was gone. Before you're losing any weight, the pain was gone. And what the general community had assumed was that the enormous amount of fat tissue was causing the pain. You haven't lost any weight in 2 weeks. Right. So it was more than that. This was an inflammatory condition that once we were able to reduce the inflammation, the pain was, dramatically reduced or even resolved. And so she started seeing, well, what can it do for then the rest of all the other symptoms, the easy bruising, the excessive fat tissue, everything else that was happening. And she was, of course, getting spectacular results. So what I saw happen, probably starting in about 2019, is that all of these people around the world, researchers around the world, started doing research specifically on lipedema to see the impact of this way of eating on the symptoms of lipedema. And now there's probably been at least half a dozen clinical trials, case reports, and other types of research that are in the published peer-reviewed literature. It's not so much with lymphedema, interestingly, because we have an animal model for lymphedema. We can induce it in, for instance, mice. And so because it's perceived as a dangerous way to eat, maybe we should test it on mice before we really test it on people with lymphedema. And so there's been much more animal research on a ketogenic diet with lymphedema, only, well, mine and one other study with human subjects on lymphedema, but we have this huge, growing body of evidence on actual people with lipedema and the effects that it's having. And now I'm not the only one talking about it. I'm so thrilled that I can go to a conference and other people are saying something about it. And so it's not just this wacky Leslyn that is saying that this might be a good way to eat.
You all can meet Dr. Leslyn Keith and ask her your personal questions by joining the next Steak and Butter Gang Carnivore Challenge. She will be visiting the community as a guest speaker, so all the members will be able to learn from her directly. To not miss the next challenge featuring Dr. Leslyn Keith, Dr. Anthony Chafee, Dr. Robert Kiltz, Dr. Tony Hampton, and Coach Rebecca Heichman, make sure you visit the URL shown on the screen, sbgmeetup.com. I've also linked clickable links down below in the description box.
Yeah, so I wanted to ask, how long was your study that you've done?
It was 12 weeks. So, and it was actually a full lifestyle program that I did, where I had, besides introducing ketogenic diet, we talked about exercise, sleep, stress management, other lifestyle changes that can help improve just overall health. And I'm hoping also with the lymphatics. And I would say that the number one biggest change that people had to induce in themselves was changing their diet. You know, this was pretty radical change. The next biggest change was exercise. They might not have been moving very much, and so maybe they moved a little bit more through that 12 weeks. And sleep and stress management, you know, they learned some good stuff about that, but may not have implemented those changes so much. So I really see as the biggest driver of what happened in that small 12-week pilot study was those 6 people that changed their way of eating, that really drove that. And so I developed an entire program based on what we did. And I still firmly believe that you got to change your diet first. I'm not going to tell somebody to exercise and move when they're in so much pain, when they have such a large size that they can't move nicely and comfortably. And so let's reduce the pain and maybe reduce the percent body fat and get you more comfortable. Then we'll bring on the exercise. But we can definitely bring on other things like, you know, stress management and helping to improve sleep and stuff like that. We can do those things, but I'm not asking people to exercise. It's a failure, you know, right when we start, you know, that if they feel like they failed because they can't exercise. Right. But once that pain goes away, they're going to start moving more.
I love the part that you said that you've noticed that before people even lose weight, their pain goes away. So to me, is it really about weight loss? It's more about pain removal as far as I'm concerned. And we've seen that over and over in the carnivore diet, that people's pain go away and their weight doesn't necessarily budge. Some even gain weight.
And I do think that and when we have our lymphatics working better, and when I see that water loss and that volume loss in that first couple of weeks, I feel like the lymphatic system, which is one of its jobs, is that waste removal. I feel like it's removed those inflammatory particles. It's made the interstitium and that tissue healthier. That is a huge impact on that pain reduction. So we're helping the body and the tissue become healthier because the lymphatics are working so much better before anything else happens.
I've noticed in myself, I carry lots of weight in the lower body, used to have pain with that, lost enough weight that I don't have pain in those areas anymore. But the structure of the fat looks different. And we've kind of seen this in our community that sometimes carnivore, even if it's weight gain, it looks really different. So I hear what you're saying, that the matrix, there's almost something that changes with the matrix that really changes the nature of that.
Emily, previously having pain, I would say you probably have lipedema, but very, very well managed lipedema. It's just a spectacular result. And you did, of course, you've lost something overall, but your body is much more proportionate and you don't have that pain. I mean, this is just a spectacular result. Well done.
Thank you. Pain-free, feeling great, carnivore and fasting for the
Yes, we have a Facebook group for the people with lipedema that are doing this way of eating. And she submitted this before and after picture. I think it was only maybe 30 days difference before and after. There was a noticeable size difference, 0 pounds lost, but the size was different. And so, you know, so those things, that decreased pain and the volume difference, a lot of times will happen before there's any weight change. And are we losing body fat and we're gaining lean mass? You know, so that therefore, you know, we feel so much better. The size is different, but the weight is the same, or even, as you say, Raymond, it's been increased. If you're not doing, you know, body composition scales and all these other things to measure, you're not really sure. But if the things are better, why not continue, even if I don't know why it happened, you know?
Can you speak to cellulite? This feels like it's on topic with body composition coming around. What can we learn about that?
Yeah, and I think for years and even now, lipedema can be confused with cellulite. One nhưng is that women tend to get fat in that gynoid presentation, in that lower body. But it's not typically painful weight gain in that lower body, but that kind of a dimpling type fat that we associate with cellulite can look just like lipedema. And so, but if there isn't pain, then we're saying, okay, this is some type of lipodystrophy or cellulite. It's not necessarily lipedema. But because we're finding that the ketogenic diet is so beneficial for lipedema to reduce the pain, we are now changing the definition of that case definition of lipedema to be current or historical presence of pain, because many women have figured out how to use diet to help control that pain. And it doesn't mean that you don't have lipedema, because as you say, it still can be, even with the use of the diet, you could still have some asymmetry between your upper and lower body. It's like you just still have that lipedema shape. It's just smaller. Your symptoms are reduced, but they're not totally gone. So I would say that you still have lipedema, but well-managed lipedema.
Well, Emily, since I have this photo and I'll put it as an overlay when I edit it, can you just give a brief recap of what you did? Like, what were the major changes that you did to get these results?
My initial was ketogenic with fasting. So I think I got it right off the start. I had read Dr. Fung's book and had combined those two. And I actually was doing extended fasting during that period of time. And so I had lost my first 100 pounds in that manner. And then I switched 2021, I went 100% carnivore, but still had intermittent fasting, started doing shorter fast, alternate day fasting, and high fat. I was very high fat. And I was gonna, when I ate just high fat carnivore, I did want to touch on that too, about, you know, your thoughts on dietary fat and whether that was, you know, what place that had in this journey. So yeah, I did a feasting and fasting protocol with Bella and Raymond, and that's what finished me out and got me the final results, was combining a high fat carnivore with fasting.
As you're a coach, Emily, you'll be able to identify these women who you suspect have lipedema, and, you know, using your own experience to help them, because women tend to gravitate towards a plant-based diet. And you know, talking to someone who has that life experience can help them at least adopt more animal sourced eating, even if they won't go totally carnivore. I feel like you're such a huge boon to the community.
And that's what I love doing, is providing support, and our community has done that. And so many women and men are really suffering with the lipedema issues. So I love that, you know, you're going to be helping us navigate that.
So let me speak to what you're saying about fat. Definitely, we were finding great results with keto, and then specifically with lipedema, and I think we're going to see with lymphedema as well. Going carnivore and the more and more animal source foods that someone was eating seemed to help even more. People would kind of be at a stall. They'd have an initial response that was really wonderful. They start feeling better, but then, you know, couldn't seem to get, you know, reach their goals of what they wanted to do. So many of them are really looking more just at the number on the scale and not all those other non-scale victories. But that is one of their goals. And so we try to help with that as much as we can. And it seemed to be carnivore seemed to be the answer. And so I have my own theories about that. And one of, it's the lymphatic involvement in the issue, because that pooling of lymphatic fluid seems to cause a proliferation of an adipose tissue. And so if we can get the lymphatics functioning better, then we can get a reduction in adipose tissue.
For all of my carnivore mamas and papas watching this video who want convenience yet affordability when it comes to carnivore living, I highly recommend checking out Thrive Market. This right here is my Thrive Market box, and I'll show you what I like to get every month. This is the first thing that I get. It is Thrive Market's very own beef sticks. This is actually cheaper and comparable to Chomps, the famous sausage stick brand. No additives, no sugar, and they're great to take on the go. I always stock up on their Rosy line dishwasher detergent pods. These really get the job done, especially if you're a carnivore and you have lots of greasy, fatty plates. All of Thrive Market's Rosy line products are free of any chemicals, harsh synthetic fragrances, and are great for sensitive, allergy-prone people. This is also a must in the steak and butter household. It's basically Molly Suds dryer sheets, and these are great. Nice lavender scent, and again, they definitely get the job done. And finally, this is a great staple to have in any carnivore household when it comes to salt. I always get their bulk large bag like this one. I actually lost the lid, but they frequently go on sale, have great discounts on Thrive Market, so I always bulk buy. Thrive Market is basically an online subscription-based grocery store. I personally love to shop on Thrive Market through their app because I can filter out any diets that I'm not interested in. I like to tick the keto diet option because the results that show up are actually mostly carnivore friendly as well. You'll see a lot of popular products and snacks like pork rind chips and lots of other sugar-free carnivore friendly foods. If you see any lower prices elsewhere and on other sites, they will always price match for you. And of course, shipping is free for all orders over $49. If you guys want to check out Thrive Market, you all can get 30% off your first order plus a free gift worth up to $60 when you go to the URL shown on the screen, thrivemarket.com/steakandbuttergal. I've also linked them down below.
And I discovered two things through animal research. Research was showing that a high fructose diet, specifically fructose, seemed to cause inflammation in the lymphatic vessels, meaning that they were so swollen that the lumen, the opening in those vessels, was reduced, and the transport capacity in some cases was reduced as much as 50%. So now if you already have an impairment to your lymphatic system and now you reduce that ability to drain the fluid, of course you're going to get more fluid collecting. And this was demonstrated with humans. They weren't trying to demonstrate it, but they were looking at women who had breast cancer related lymphedema in their arm. And they said, let's look at the impact of exercise and a weight loss diet on the lymphedema in the arm. And so the weight loss diet that they chose was, can I say a brand name? It was a meal replacement that they were using. And the number one or the number two ingredient was fructose, high fructose corn syrup.
Oh,
Like a liquid diet, like a Slim Fast or
They're drinking this.
Fast. Yeah.
Yeah. I've tried not to say a name, but so this was what they were using. So it was end up being, they were having a high plant content diet. So fruits and vegetables, and then drinking this high fructose thing. And so the calories were down, the fat content was down, and then they were exercising. All of the women lost weight, but their arm swelling did not go down.
wow, that's telling. Yes.
And every other study that they had done previously to this, of just maybe even using a plant-based, low calorie, low fat diet, but no high fructose thing stuck in there, they lost weight, and then the arm size would go down. This one, it didn't. And they were confused. They said, we don't know why this happened. And they happened to present their results at a conference, a lymphedema conference, and I was speaking after them. And I go, oh, I think I know what happened. And I'm sure they weren't pleased with me, but I said at my presentation, I added on a little thing. I said, I think this might have happened since we know that high fructose causes those lymphatic vessels to swell. Even though they lost weight, they couldn't get the fluid out of their arms. And so my first thing is to say that carbs are inflammatory and plants are carbs. Okay, so the more we reduce our carbs, we're going to have less inflammation. It means reduced pain and better flowing of the lymphatic vessels. And so then, but the other thing is, wow, animal research anyhow seems to show that fat fuels the lymphatics. And so there was several pieces of research that helped me put this together. But one was that the lymphatics are specifically what gets the long chain fatty acids from your gut and travels through the lymphatic vessels to the blood circulation. You can't get those long chain fatty acids otherwise. The medium chain and the short chain go directly to the liver through the portal vein. But everything else and most of the fats we eat are long chain. So we're going to have a deficiency in our fatty acids if we don't have that functioning lymphatic system. And so interestingly, when they did research they said, well, let's give the lymphatics a break and let's not feed the person any long chain fatty acids. So we're only going to give them medium chain fatty acids, like a coconut oil, and you can get MCT oil and stuff like that. And so they did this pretty short interval, I think maybe a week of intravenous feeding of just that type of fat. Mm-hmm. And then they were measuring what was the fat content of the lymphatic system pre and post using this way of diet. Post using MCT only, there was now MCT fats in the lymphatic fluid. It said, I'm desperate. I got to have some kind of fat. And so normally it wouldn't take any of those fats, but it did. But not only that, on animals, and now a recent study out of Belgium with humans, is that they're showing that there's new vessel formation when we increase the ketones and fatty acids in the diet. So in this study that just was completed in Belgium with people with lymphedema, they did actually imaging of the lymphatics, and they showed new vessel formation. Cool. And you can imagine if someone has an impairment, say, in this area from their breast cancer, if you have new vessels that help get the fluid out, that's going to dramatically improve your lymphedema. And that's what they saw. On animals, what they saw was that even if you had ketones and fatty acids and glucose present, the lymphatic endothelial cells went after the ketones. It had a natural preference for that. So to me, it sounds like this is a way of eating that, yes, wonderful, it manages your weight, but it is so much more important to your health. And one of the body systems it helps with is a lymphatic system. It just operates better with low carb, high fat.
I am so motivated when you say that, because we know that about the brain, about the heart. We know that about, certain organs and tissues that, how great they do off of ketones. And so I'm just going to add that to my list, and the lymphatic system, because you said so.
That's right. And it's everywhere. And now we've discovered the lymphatic system in the brain. So that's also helping with that. And the lymphatic system works in the brain mostly when we're asleep. So Emily, when you're helping your patients improve their sleep because of the way they're eating, now the lymphatic system can clean out the brain and remove those inflammatory particles that lead to dementias and neurodegenerative conditions. They are doing better because their lymphatics are working better. But Emily, you asked about, what do you think about high fat? And this is, it's a nuance on what we're trying to figure out and what we want to recommend for lymphedema and lipedema. And it seems to be very individual, because some people work better on, if you're going to be carnivore, work better on high protein, others work better on high fat. It seems like people with obesity, well, I guess they could do both as well. Because it seems like the people with obesity, a lot of times they don't have to eat high fat in order to meet their goals for reducing the percent body fat and losing weight, because now they can access their body stores of fat, and that is the fat part of their diet. But I guess it depends on what other comorbidities that they have, because there are definite cases where people tend to do better with a higher protein and not so much high fat. And there was a wonderful article was talking about, this way of eating that we discovered that is good for controlling seizures may not be necessarily the macros that we want to use for various other conditions. And so there's tweaking that has to be done, which is done by you guys, the coaches. It helps people figure out where, once they've got the general idea of the diet and enjoying it and getting some benefits, now you guys have to help them figure out what is going to be that particular nuance is going to benefit them the most and what's going on with them.
You all can meet Dr. Leslyn Keith and ask her your personal questions by joining the next Steak and Butter Gang Carnivore Challenge. She will be visiting the community as a guest speaker, so all the members will be able to learn from her directly. To not miss the next challenge featuring Dr. Leslyn Keith, Dr. Anthony Chafee, Dr. Robert Kiltz, Dr. Tony Hampton, and Coach Rebecca Heichman, make sure you visit the URL shown on the screen, sbgmeetup.com. I've also linked clickable links down below in the description box.
Really enjoyed your talk. It seems like I have three things I'd like to discuss with you. The first is, it seems, looking at your articles that are published on PubMed, that you've kind of started out thinking lymphedema and obesity is the association. And in sleep apnea, we have the same association of obstructive sleep apnea and obesity, but when you really look at it, it sounds like your framework is moving towards reduction of inflammation as a bigger mechanism than the obesity itself. And
Yes.
we're seeing that in the sleep apnea literature too.
Yes.
And they're starting to measure some very unique inflammatory markers that are elevated in people with obstructive sleep apnea, that as those markers go away, the symptoms go away, irrespective of what happens to the weight. So are you familiar with any markers that are associated with people with lymphedema, especially that are being measured?
You're absolutely right that my initial way of looking at this way of eating was, from Gary Taub's book, Why We Get Fat. And having, 70% of my patients have not only lymphedema, but also obesity. And so I was initially just looking at how can I help them lose weight? But it's definitely morphed into more of this healthy situation. And I do believe, just as you're talking about sleep apnea, that people thought, oh, okay, you lose weight and you have less pressure on your neck, and then that's what does it. No, I think it is, as you say, a reduction in inflammation that has that impact. I have sleep apnea myself. I'm 6'2" and 165 pounds. It's not caused by obesity. And my sleep doctor was telling me that no, that the majority of my patients, they do not have obesity related sleep apnea. This is something different that is happening here. And so I do think that more than just the lymphatic community, but in general, people are saying that, okay, these different conditions that have been associated with obesity is more to do with the inflammation from obesity and not from the excessive fat tissue, the excessive weight.
Well, it's interesting, in the female population since 2006, sleep apnea literature has noted that the ratio of men to females with sleep apnea has actually reversed. And there are more women developing obstructive sleep apnea than men. And I think it may be very much related to veganism and the adoption of plant-based diets that's being perpetuated among women. And I think it needs to be studied. They found tumor necrosis factor and interleukin-2 as being the two that were in obstructive sleep apnea. But it's interesting that the published literature hasn't really caught up with that yet.
Yes.
Your 2017 article that you wrote, and by the way, I enjoyed your articles on PubMed. So thanks for contributing to the published literature. That's peer-reviewed literature is very important. I'm really glad that you pursued your doctorate so you could do that. But I think it's really important. So the other thing is, one thing, I spent a lot of time, I was a surgical PA before I went to medical school. And we talked a lot about mastectomy-induced lymphedema of the upper extremity. And the ultimate complication of that is Stewart-Treves angiosarcoma, which is a very, very bad malignancy that I've only seen once in my career. But that to me also tells me that it's an inflammatory condition, because we see a lot of cancers progress from obstruction to inflammation to hyperplasia to dysplasia to malignancy. And sarcoma is a soft tissue malignancy that we hardly ever see in an upper extremity, except in women who have had mastectomy. So some people don't realize that this can actually be a fatal condition, not appropriately treating lymphedema. So I just want to make that comment that this is very serious, and we should be tackling lymphedema with diet whenever possible. I think there's a difference between surgical induced lymphedema and radiation induced, which are physical removal or either removal or atresia, which means shrinkage from the radiation, is scarring down. But the typical lymphedema we see in the carnivore community is more of a physiologic or pathophysiologic edema. And the interesting thing is, as you know, all the lymphatics from the lower extremities have to go through the abdomen and chest to the thoracic duct to actually drain into the circulation and those long chain fatty acids to be utilized. And we're seeing incredible results of people using vibration plates, which I think is adding kinetic energy to the process to serve as a mechanical pump to break up the sludge in the lymphatics in the intra-abdominal and intrathoracic areas to move the lymphatics along. And I didn't know if you've come across any associated studies where anyone's looking at that, but we've certainly seen a lot of the pain go away with lymphatic addressed, plugged lymphatics addressed with vibratory kinetic energy.
And there definitely there's been some papers on that, more with lipedema than lymphedema, but both. There is some papers on that. A new theory that I've been talking with some of my colleagues with is that there's microclotting in the lymphatics. It's not something that just happens in the blood. It could also happen in the lymphatics. Besides reducing any fibrosis that may be in the tissue, we feel that maybe the vibration helps with that microclotting that's happening in the lymphatics. And diet would also help with the microclotting. You know, maybe we're getting this improved flow, not only from the health of the anatomy of the lymphatic system, but also with the content of the lymphatic fluid itself.
Well, I think it's interesting, your comments about fructose, because I really believe that the high fructose corn syrup, which has become the preferred sweetener in U.S. food manufacturing. And we know fructose is highly glycanogenating of our proteins in our body. It makes perfect sense that high fructose diets do not help this condition, which again puts this in the inflammatory glycosylation process. I'm intrigued with your work, and keep up the good work.
Thank you. Yes, I intend to keep going. Reading a whole book or trying to tease out the language that seems to be in peer-reviewed papers is beyond them. You know, and maybe they'll read the abstract and the conclusion, but nothing else. So you guys are really providing wonderful service.
Thank you so much, Dr. Keith, for your time today. I relate to you when you were sharing about cancer. My mom actually passed away 9 years ago this July from breast cancer. She had stage 4 metastatic breast cancer, and part of the treatment protocol was to remove her lymph nodes from her underarms. And I remember she had the compression sleeves. She had severe lymphedema, like she would have to keep her arm up over her head. She would always ask me to massage the arm because I was trained in Swedish lymphatic drainage, and they promoted juicing. That was like the big thing. And I noticed, and I wish I would have put 2 and 2 together back then, but I noticed every time she would juice, her swelling would get worse. Her pain would get worse. She wouldn't be able to sleep at night for obvious reasons. When you're juicing fruits and veg, what is happening? But I wanted to ask you the question for anyone who may have missed it. Do you think it's to a person's benefit or to their detriment that they're removing these lymph nodes as a part of a cancer treatment protocol?
It's certainly, as far as lymphedema is concerned, once they adopted the sentinel node biopsy and removed fewer nodes, it certainly helped. But there are some cancers that they always metastasize to the nodes, and you can't just take a couple. But specifically on breast cancer, They just wanted to see, did the cancer metastasize? Did it go outside of the tumor? And then that can direct us on whether or not we need to do something like chemotherapy. Now, the whole standard approach to cancer, that's a whole other discussion. I'm really not in favor of radiation therapy and chemotherapy, but a lot of people do engage in that standard care for cancer, and it does seem to, at least in the short term. So I think that, just by removing fewer nodes, that is a help. But we know that there's such a variety in how many nodes you're born with. And what we couldn't understand is, why did this person who had sentinel node biopsy, 1 to 5 nodes removed, why did they still get lymphedema? They had no radiation treatments. They just had those nodes removed. Why did they still get lymphedema? Well, it could be diet and inflammation related, but it also might be that they were actually born with only 8 nodes instead of 30 under their arm. And so you remove 5 of those, well, of course, you're going to get lymphedema. I mean, it used to be the protocol was the surgeon had to dig around there and remove every single node. They felt like this was life-saving. So 100% of those patients with breast cancer that had that severe surgical procedure, they all got lymphedema because there were no nodes left to drain out of that area. And so it certainly has helped to remove fewer nodes, but when you look at that, even with the fewer nodes, if you still have high inflammation, and you didn't start out with a lot of nodes, there still is a good chance that you're going to get lymphedema. And so that patient that comes to our clinics, we never can tell them, oh, you are not going to get lymphedema. So you only had 1 node removed and you had no radiation, you're not going to get it. We can't say that. If they have that high inflammation lifestyle and just that 1 node removed, they still are at risk for lymphedema. And so that's why the National Lipedema Network doesn't say precautions or prevention of lymphedema. They say risk reduction practices. Here are some things that you can do to reduce your risk of lymphedema. And I think that the strongest thing they can do is to have a low inflammation diet.
Oh, I wish I would have known that then.
I know, and that's how we all think about not only our care of our patients and our family. And I mean, we all think that, gosh, what a disservice I did. I didn't, but we didn't know. But the wonderful thing is that you can't unknow this stuff. Once you learn it, now you can be of help.
I totally agree with you on the, not being able to exercise lymphedema away until you get your diet squared away. Because when I was at my heaviest, my legs were so swollen and so heavy, they're actually pulling my hip out of joint when I tried to lift it up,
Yeah.
And so it was actually a serious problem. But I do definitely function better on a high fat diet with lower proteins, which is kind of crazy. I know you'd brought that up once before, but however, I have noticed recently long-term fasting's been doing the greatest benefit for me. I do every other week, I do a 7-day fast. So I basically eat for a week and do a 7-day fast for a week. I was wondering if you have seen any literature or know anything on fasting. What part does autophagy play in healing up the lymphatic system? Our
bodies are undergoing autophagy everywhere constantly, and certain things may increase it and some lower it, but that's definitely happening. Another theory that we're working on in the lymphology community, specifically with the diet and lymphology, is that people who have an impairment to the central lymphatics, the lymphatics of the trunk, specifically get increased fluid load and bloating and difficulty breathing when they eat. Starts out with just eating a lot of fat, but then it turns into just eating a lot. Eating anything, not necessarily a lot, but eating anything. And what we're thinking is that the lymphatics are so impaired, and of course it's involved in that movement of fluid and fat, that anytime we eat, it's stressed. we got to have those fats and we got to eat. But in that specific population, doing the fasts seems to help. And that might be what's happening. But of course, you know, fasting is not a sustainable long-term solution. Every once in a while, you're going to have to eat. And I do believe that you definitely don't want to have a fatty acid deficiency. So you're going to need to have fat. And I do think that there's a potential that fat are actually healing to the lymphatics. And so that may be another reason why it was good for you to be high fat. It could be that proteins for you was causing too much of an insulin response, and then it didn't
100%.
do well to have the high proteins. What we're discovering, we have a small community of about 20 people who we suspect have some kind of dysfunction in their central lymphatics, and we're trying all kinds of things. And some do better with having higher fat, and some do better with higher protein. It's very individual, and we're trying to, how do we help the lymphatics function in that everything's got to go to the trunk, right? Coming out of the arms, head, neck, and your legs are all going to the trunk. And if this is not working, we're going to get fluid left behind, and that fluid is actually going to cause the proliferation of fat. It's going to exacerbate what's already happening. And so how can we support that? And so we are looking at, for instance, using a pneumatic pump with the trunk attachment. So this fills with air, and it does kind of a massage to, typically it's going to do it to the legs, but it's also going to do it to the trunk to help move this through the, help us, you know, encourage the lymphatics to deliver the fluid where they're supposed to go. But with that central lymphatic dysfunction, some people are getting it going backwards. It's going to the kidneys, it's going to the liver, it's going to the lungs. And of course, you can imagine that impairs the functioning of those organs. So we have to figure out, how can we support that fluid movement without doing it too well, because a lot of it's going to reflux and go the wrong way and exacerbate what's happening. And so, you know, Todd, I think that you are one of those people that has some difficulty, some challenges with your central lymphatics. And so figuring out what is going to support them, but not support them too much so that you can improve without having some of those symptoms worsen because we're getting stuff going the wrong way. It's a very difficult situation.
Well, honestly, you were the one that told me that through the thoracic duct, it was refluxing going to my lungs. And I definitely think that was 110% happening, because since I've improved so much with the impact of lymphatic tissue and stuff, I don't have the lung issues anymore, you know, and that's been a lifetime issue. But lately, what I've been doing that's been working wonderfully, I do the Wim Hof breathing, because I noticed that opens up the diaphragm.
Yes.
And then I do the shake plate on my feet for 10 minutes, and then I do the shake plate on my arms for 10 minutes, and then I do the rebounding, the calf rebounding, in that order, and I can feel it moving the fluid. And then if I wear compression socks and I do long-term fasting, what's good about those two things is it doesn't come back on. Like before, it was just a yo-yo. Like it was just a revolving door. I'd get it off, it'd come back on. I'd get it off. And I mean, it could fluctuate 15 to 23 pounds in a 24 to 48 hour period, you know?
Right.
And now when I do that system, it stays off. I don't, you know, maybe I'll have a 10% backlog, but it does not come back on like it was before. So I do think it's actually healing, and I contribute to that mostly to the fasting.
But then when you are eating, you're eating the right way, and you're also supplementing it with those other modalities with the vibration. One of the biggest movers from our lymphatics and our venous return in the lower body is that calf pump, and you're really activating that with your rebounding. You don't have to even leave the rebounder. You know, you can just keep your contact with it, and that is activating that calf pump.
I really find that to be successful on that rebounder, when you're coming down, you really got to point your heels down and get the stretch of the calf. And if you do that, you get 5 times as much pump out of it. I noticed I move more fluid.
Well done. Well done. You need to share that a lot, what your protocol is, and let people try that. And I think it's going to be very individual, but knowing the things that you do is going to help other people to try those things and see what works for them. It may be it works better in a different order, or they might throw in something else like dry brushing or something else. But it's having those N=1 experiments and sharing that with people helps people to see, this is something I could try. This is something that might help me.
And remind us, how long have you been carnivore? Speaking of things that are sustainable or not sustainable that we try out, what's your carnivore journey been?
I was keto starting in about 2011, 2012. And then I went carnivore in 2019. I'd already, a lot of people in the community were doing it, and so I was intrigued by it. But I had the opportunity to try this body composition analyzer. Had a 1-month trial in my clinic. So it looked at fluid levels and lean mass and fat mass. And it was quite expensive. I think it was about $14,000 unit. And I thought, well, I'm going to use it for a month, but of course I'm not going to buy this thing. And so I was using it on all my patients, but I thought, well, let's do this. I'm going to hook it up myself, get my results, and I'm going to start carnivore that day, and then test when I have to return it in a month, and I'll test it again. And the results in the fluid composition, my lean mass, my fat mass was so startling for such a short time that I thought, well, of course I need to go carnivore. And so I've never gone back since 2019, doing it that way. And so now that all of my friends and colleagues look at me like I'm even crazier.
Definitely. That's so inspiring. And Dr. Keith, are you more high fat, moderate protein?
I'm slightly less protein than I am fat. It would be like 65, 45. And I do tend to eat probably the same six foods, maybe 4 foods all the time. And that, it is amazing that that's one of the complaints. If even just going keto, they think about using the diet and they go, well, it's just so monotonous. Mm-hmm. So it's not monotonous that you have oatmeal every morning, you have the same type of sandwich for lunch, and you have the same, 3 dinners that you have every night. I mean, they don't understand that they're already doing something very, not a lot of variance in their way of eating, anyhow. But I just never get tired of steak.
And Todd, just to go back to you for new viewers who want to know what you're doing to get such great results, you mentioned that you're higher fat, moderate protein. What's a typical meal, ideal meal for you? And how many years of carnivore are you right now?
20 months carnivore. Lately, I've been doing a 2-to-1 fat to protein ratio, and getting most of it from egg yolks and tallow. And so I eat about a pound of beef a day, and I am working on, being that I do a alternate fast every other week. I eat 1 week and I fast 1 week. I've been eating, trying to get kind of doing a mini prime every other week. And so I've been, right now I'm eating 54 egg yolks a day when I am eating, because I'm trying to get the DHEA from the benefits of the egg yolks, and about a pound of beef. And then I substitute with the tallow to get a 2-to-1 fat to protein ratio right now.
A question for you, Dr. Keith. For those who are watching this video and they're seeing that all we eat is steak, Todd is eating 54 yolks a day, and they're wondering, is there such a thing as eating too many eggs or eating too much bacon? What's your answer to that?
I think that Andreas Einfeld years ago did a thing, to give the cutoff for a number of eggs, but I think he said 26 eggs. There wasn't an outside number of eggs that we could say that were going to be detrimental to health. And as far as bacon, I have recently, it seems like the ApoA, I'm not even sure which one, but one of those little markers. And when I eat a lot of bacon and when I use lard to cook everything in, it seems like that number goes up. But when we look at our numbers, I mean, it definitely might indicate something is happening. For instance, the TNF alpha can say that you have increased inflammation or something like that. But I think it's a difficult trap to go into to treat your blood panel and not treat what's happening, actually happening in your body and how you feel, stuff like that. So I do tend to eat bacon every day, but I add increased lard when I did like a 30-day no dairy challenge. Didn't really notice a difference. So now I'm cooking in butter. So I don't know if that will change, my blood panel number. I am one of those people that I find it kind of fun and interesting just to go get blood tests and see, I wonder what my vitamin C levels are. I think I'll get my blood drawn. So I'm not so sure that there is a problem with, having a lot of pork fat. There is a lot of talk about, poultry and pork, and maybe that's not the right kind of fat. I'm not so sure. I mean, that's a nuance that I'm not too terribly familiar with. I do think that there can be a problem with those seed oils, that may not be the best kind of fat. And I think we're getting more evidence to that. What are your thoughts out there?
Like, I've been eating a stick of butter a day, like my first year of going carnivore, and it has completely healed my hormones. And I think maybe hormones
Nice.
also have a lot to do with lymphedema and how your lymph nodes are functioning.
Mhm.
I've seen a complete change in my body recomposition. So I feel like things are working well. Hormones are happy. And to this day, I still eat a lot of fat. Like, I'm probably the highest fat carnivore I know. I
Interesting.
prioritize fat.
And dairy fat seems to be okay for you.
Very
Yes.
okay. I do.
I definitely, I love my cream and I love my butter. So, and I make homemade ice cream with about 18 egg yolks and one of those little pints of cream, maybe a dash of vanilla. Don't need anything else. And that I think the more egg yolks that I put into it, Todd, it tastes better. I am so thankful that I do well with dairy fat because it tastes so good.
It does. It really does.
For sure.
I unfortunately don't tolerate dairy as much as I hate to admit it. I cut dairy out probably over 2 months ago, noticed a significant difference. All of a sudden, butter just didn't taste good to me anymore. And I was like, that's
yes.
weird. So I started with tallow, and now, like Bella was saying about how she had all the body recomposition, I'm experiencing significant body recomposition. Like, weight is just melting off of me, inches are melting off of me, and I'm like, has it been the dairy this whole time? Like, so dramatic because I love it so much. But it's true. It's just my body just doesn't process it the way, say your body does, which is a real big bummer.
Keep in mind this. Sure, you guys are all familiar with Siobhan Huggins. She has found it's so interesting. Our body needs seem to morph over time. And she actually, for a time, had an egg allergy, but now she doesn't. So think about this, Rochelle, that you may at a point in time do good with dairy again. I mean, that is that potential that's out there. It's just that she's been carnivore for quite some time, but she got a hankerings for, I can't remember what it was, some plant kind of food. And what she was thinking is, maybe there is a nutrient in there that I needed. So sometimes your cravings are not an addiction like it is for sugar, but it is actually that you're seeking as a particular nutrient. And so she said, okay, well, I'm just going to eat that, whatever that is. And then after a month, it didn't taste so good anymore. So she got what she needed from that and she stopped eating that. So consider that there was this wonderful study with goats that they did. They took out this vital micronutrient out of their diet. And they found that those goats ate and ate and ate, and they didn't stop eating because they needed that particular nutrient and they were trying to get it. And so they had that compulsion to keep eating merely because they were seeking a nutrient that wasn't there. And so that can contribute to, at least there is a certain portion of the population that gain a lot of weight because of the binge eating. I think besides addiction, we have to also look at, is there a nutrient that they're not getting? Maybe because they're more plant-based, binge eating. So they're not getting a nutrient that they need that they get from an animal source food. So it's just something that make it more complicated, right?
Oh, well, I appreciate the encouragement, because I'm also at the point where I'm hypersensitive to eggs. I cannot tolerate eggs. I cannot tolerate dairy. But, a few weeks ago, I couldn't stop craving dairy. I was like, what is going on? Like, I haven't had dairy in weeks. And I had one meal full of dairy. I got my dairy fix. I don't know what I needed from it, but that was it. I didn't want to go back to it after that. And you just saying that kind of just confirms what I already know about myself. My body is just communicating, hey, I need this right now. Can you give this to me? I gave it to my body. It got what it needed, and now it's gone. I'm like, all right.
And that tells me that wasn't an addiction for you, because
correct.
That one little hit of sugar, you're on to sugar, right? You can't stop eating the sugar, but you got what you needed from that dairy, and then you're good.
Dr. Keith, I'll link your 2 books as well as your website down below under this video for viewers to check out if they want to get to know you better. But I would also love for you to share, how can the community support you and keep up to date with your research?
A couple of emails. I think one you already have, Bella, is Leslyn Keith ot@gmail.com. But I am really heavily involved in the lipedema community, and a lot of the papers have come out with my work with that community. I am the director of research for the Lipedema Project. And so to specifically reach me about those concerns about lipedema, you can reach me at leslyn@lipedemaproject.org. That'd be the 2 good places to reach me.
Excellent. Do you have any support groups? Are you on social media?
With another colleague, another occupational therapist who is into the ketogenic way of eating, Robert Erkstom, I have formed a lifestyle group for people with lymphedema and sometimes also obesity. We do lymphatic lifestyle solutions. And you can find out more about that from my website, leslynkeith.com. Also, it has links to my books and presentations. You just go to my website, leslynkeith.com.
Let's all say a big thank you to Dr. Leslyn Keith. Thank you so much for being
you,
here.
Dr.
Thank you for your
Keith.
time.
Thank you so much. It's been wonderful chatting with you all.
Thank you so much for watching this roundtable interview. I hope you found it helpful. You all can meet Dr. Leslyn Keith and ask her your personal questions by joining the next Steak and Butter Gang Carnivore Challenge. She will be visiting the community as a guest speaker, so all the members will be able to learn from her directly. To not miss the next challenge featuring Dr. Leslyn Keith, Dr. Anthony Chafee, Dr. Robert Kiltz, Dr. Tony Hampton, and Coach Rebecca Heichman, make sure you visit the URL shown on the screen, sbgmeetup.com. I've also linked clickable links down below in the description box. And finally, before I wrap up, I just wanted to share something that I have been incorporating every single day that has really leveled up my energy and sleep, and that is wearing blue blockers. This is a new one that I actually got from my favorite blue blocker brand, and I've been wearing this during the summer months. This is what it looks like when I wear it on. I love its minimal clean look, and specifically just the maximum protection that it provides when I wear this red one in front of blue light. So if you are using phones, iPads, computers, TVs, you are looking at blue light. And when you look at it late at night when it's dark outside, it could disrupt your sleep quality and it could make it more difficult to fall asleep. So because I have been wearing it every single night right before bed, like about 1 hour to 2 hours before bed, it has really helped me be able to fall asleep basically instantaneously. And I'm able to stay asleep throughout the night. On Charge also offers a great selection of other biohacking tools and equipment. And Steak and Butter Guy and I have also been loving their infrared sauna blanket. It's basically a blanket that you plug in that wraps 360 degrees around you. You choose the setting that you like, and you can enjoy all the benefits of infrared light therapy while just lying down and relaxing. And it also does heat up, so it's incredibly comfortable on those cold winter days. If you guys would like to check out any of my biohacking favorites, I'll make sure to link them down below in the description box, and you all can use the code SBGAL for 15% off your purchase. All right, thank you so much for watching the video. I hope you guys enjoy the rest of your day, and I'll see you in the next one. SBG out.